Good afternoon, ladies and gentlemen. Our webinar is beginning. Delighted you're with us today. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council, and we appreciate you joining us for this educational webinar hosted in coordination with Konica Minolta, an associate member of the Council. As you know, today's topic is the future of hospital security, and this is a very important topic, especially with some of the recent events of violence, not only in society, but in hospital workplace. Security is quite important. We have a great turnout today, and we're looking forward to the presentation. It's my pleasure to start the program and introduce to you the Senior Sales Manager of Konica Minolta here in the Dallas-Fort Worth area, Ty Porter. We also have Konica Minolta's Director of Product Development, Konica Minolta Video Solutions, Sooketoo, Bhuta, coming to us by way of San Francisco. We have worked with Konica Minolta now for over a decade, and they've supported the Hospital Council with business solutions, technology, and IT. They are valued friends of the Hospital Council, and we're so glad they would be with us today for this webinar. I would like to note, if you have questions during the presentation, you can please put them in the chat box, or you can also put them in the questions. So if you have a question, we want this to be as interactive as possible. Thank you again for being here. And with that, ladies and gentlemen, I introduce to you Ty Porter.
Thank you, Steve, and thanks everyone for attending today. As Steve mentioned, my name is Talentia Porter, and I go by Ty for short, and I am the Senior Sales Manager here at Konica Minolta, supporting Dallas and Fort Worth, and I manage vertical markets and major accounts here, supporting those areas. As you know, this is a very important topic that sits at the forefront of many of us. Today, we'd like to discuss something different other than copiers, which many of you may know us of. But we also are known for our superior services in technology. So today, Sooketoo will go over one of our offerings that could help address some of your concerns that you may be speaking of today. So, Sooketoo, I turn it over to you now.
Great. Well, thank you very much, Ty and Steve and Chris, and appreciate all of the attendees for taking your time to join us this afternoon. It's great to meet all of you virtually. So as Steve mentioned, we do want to try to have this be an interactive dialogue and discussion. So please feel free to ask your questions as we go through the presentation or your thoughts, and we'll try to address as much as possible in real time, but we'll also have some time for proper Q&A at the end of the session as well. So with that, I'll just start with providing a little bit of context about Konica Minolta and our solutions in the video and security space. So as Ty said, most of you probably know Konica Minolta for printing and imaging technologies and capabilities. But we just celebrated our 150-year anniversary as a company. And so kind of going back to those roots, a lot of, the origins of the company really came from the imaging space, right? From cameras, still cameras at the time, and have continued to evolve over that time. Obviously, some of that imaging technology is captured in our MFP products. But outside of that, over the past 5 years or so, we've really looked at expanding our video security capabilities, starting with the acquisition of Mobotics, which is a German camera manufacturer. And over the past few years, it really looked to expand those capabilities, not just from cameras, but also getting into AI and analytics, really to help drive more actionable intelligence in different vertical use cases. So That's, what I'm going to share a little bit about today is some of the capabilities that exist in our portfolio, and how we see them playing out in the healthcare space, whether we're talking about hospitals or acute care facilities, or long-term care or assisted living. So with that, let me move on. So when we look at the problems that we can look to solve with video-based solutions, we kind of bucket that into three areas. So probably first and foremost, as Steve mentioned, physical security is paramount, right? So obviously in the news there have been a number of kind of tragic incidents that we've all heard about recently. So unfortunately, I think as with a lot of customers, this becomes top of mind, really around how do we secure the facility and keep it safe, not only for our employees, but also for patients, for visitors, and the community as a whole, right? So that's kind of one main topic of discussion. And then the next is really, and this is something that really kind of came up at the start of COVID, right, is how do we protect for kind of health and safety in these environments. So kind of going back to 2020, at the height of COVID, there were a lot of challenges around sort of providing this level of safety, right? So making sure people coming in were safe necessarily from a physical perspective, but from a health perspective. And then also from an occupational safety perspective, right? How do we make sure the environments are kept safe? And we can protect from things like falls and other potential issues in these workplaces. And then the last bucket of solutions is really to address operational efficiencies, right? So how can we help customers continue to scale and grow, but also do this in an operationally effective way? Especially, in the healthcare industry, you look at some of the challenges that exist with staffing shortages, right? Especially with skilled nursing and support staff. And so there's technologies that we'll talk about that can help alleviate some of those challenges and really, allow companies to use their healthcare resources more efficiently. So that's kind of the context for today's discussion. We'll sort of talk about things in these three categories, and then how they all interrelate from a healthcare environment. So when we kind of talk about drill down into some of the problems in these three buckets, right? So obviously from a physical security perspective, some of the things that are top of mind are really how do we reduce physical threats in the environment? And this could be tracking and identifying and maybe restricting who comes into a facility or who doesn't come in, but as well as access to certain more secure areas of the facility, whether it's a maternity ward, whether it's a medication room. These are all areas that may have a different level of access requirement within a facility. So how do we protect all of those areas more effectively? Then when we look at just health and safety in these environments, so obviously during COVID, screening temperatures and health questionnaires was a huge priority, right? Every facility generally had some sort of process for taking temperatures, for having people fill out the standard COVID screening questionnaires. Thankfully a lot of that has gone away these days, but there's still other health and safety risks in these facilities, right? So when you look at we're talking about healthcare or long-term care facilities and memory care, the risk of elopement exists, right? So how do we protect against that? And also in these facilities, falls is always a risk. So being able to proactively deal with those types of situations becomes important. And then, like I said, from an operational perspective, the biggest, I think the most important thing is, really being able to effectively leverage the healthcare resources, right? So whether it's nursing staff, physician staff, obviously, many of those resources are in short supply these days. And so what we're really looking at in this category is different types of automation that really can free up some of these resources to be used more effectively. And we'll talk about how we can do some of that. And then more from an operational perspective in terms of running the facility, aspects of kind of the day-to-day operations around, streamlining how contractors are checked in, for example, or how parking is managed in a hospital parking lot. These are all things that we can talk about to help drive efficiency in these environments. So kind of drilling down a little bit further into these areas, when we talk about our Forzi portfolio, it's really a platform that bundles a variety of different AI capabilities. And I'll kind of talk about all of these, like I said, a little bit more in the healthcare context, right? So obviously, when you look at these capabilities, they can be applied in a variety of vertical use cases. But some of these are going to be more specific in a healthcare context. So we'll kind of spend a few minutes really drilling through each of these areas in a bit more detail. And this is a portfolio that's growing over time, right? So we're looking to continue to add capabilities in each of these areas to help drive more automation, more intelligence. So at the end of the day, the way we kind of look at this is, most facilities have a lot of video cameras, right? So you have images, you have data, and what we're trying to do with this platform is make that data actionable so that we can, drive automation, drive more real-time awareness of what's happening in the environment. So that's kind of the overarching goal of what we're trying to achieve with all of these capabilities. So I'm going to kind of walk through each of these areas in more detail, and hopefully this will kind of spur some dialogue around, what some of you may be seeing in your facilities and how some of these capabilities may be relevant. So we'll start with the security side. So as we talked about, right, there's different things, and this is, could be for assisted living, could be for acute care facilities, but when there's different use cases for this, right? So, we talked about identity recognition, right? So determining who has access to different spaces. In a hospital facility, for example, you may want tighter control of, certain spaces, right? Like we talked about, a maternity ward may need to restrict access just to the parents as far as who's going in, going out. As opposed to different types of visitors at certain times of day. There may be certain individuals, and whether it's disgruntled employees or other potential security risks, who shouldn't be allowed in the facility at all, right? So again, using facial recognition, right, using different forms of identity detection, being able to identify those individuals before they come into the facility, right? So before there's a risk of harm, being able to make those determinations and then notify someone or drive some specific actions as a result of that. And similarly, when we look at loitering, right? So this is individuals who may be in a certain area where they shouldn't be. Maybe they're been in a certain area for too long, right? Which may be a problem, maybe not. Right? Maybe it's just a question of someone who's been waiting, for a certain amount of time, and maybe that someone needs to be notified, right? That someone's been waiting too long in the lobby. So there's different use cases. Not necessarily every loitering event is necessarily a bad thing. It could also be used to help understand wait times and other things. But again, from an overall safety perspective, it helps drive just better awareness of what's happening in the facility. So some of these things are probably going to be top of mind, right? So firearm detection, for example, right? Being able to detect a weapon that may be visible. And these are some of the things that probably require the most immediate intervention, right? So obviously no one should be walking in a healthcare facility with a gun drawn in their hand, right? That's obviously something we hope to never see. But if it does happen, we need to be able to detect that in real time and notify a security officer at a minimum. And if not, drive specific other automated actions, right? So maybe there's an audible alarm that goes along with that. Maybe there's a lockdown procedure that's implemented, right? All of those workflows can be triggered off of these types of events. So when you see that there is a weapon, right, there's a set of protocols that likely exist as to what happens. And those are all things that can be automated, right? So you're not necessarily dependent on a human to trigger some of these actions. This could all happen in real time based on what's observed, and then specific actions and workflows that are driven from that based on the customer's requirements. Similarly with violent behavior, right? Again, this is a phenomenon that does occur with, I think, some regularity in healthcare facilities. And similarly to weapon detection, these are types of things that can be identified using existing security cameras. And then specific actions can be driven or triggered off of those events. So whether, again, it's alerting a security staff or some other actions, those can all be automated in real time. And similarly with intrusion events. So, if there's certain restricted areas that people should not be entering, those can also be actively monitored. And so let's say if someone does cross a virtual boundary and enters a space where there shouldn't be people, that can be quickly identified and triaged as needed. So, and this could also be from a safety perspective, right? So maybe you have a loading dock where people shouldn't be walking around because there's trucks pulling up, or an ambulance bay, for example. Those are all things that can be monitored and protected against, where people shouldn't be present. Okay, so from the health and safety perspective, again, some of these capabilities came about during COVID, right? So not necessarily all of these things are relevant today, but the capabilities all exist. And we continue to build off of these. So, temperature screening and health screening was obviously very important during COVID. Hopefully we won't be going back to some of those practices, but we never know when the next pandemic will exist or will occur, right? So, so some of the capabilities that were built as a result of COVID, still can be actively used for other use cases. I know a number of hospitals that are still doing temperature screening for everyone coming in, right? So again, these practices vary by state and region, but a lot of these things are still in place. And this is what I was talking about earlier in terms of safety of patients and visitors. So elopement is obviously a huge concern in long-term care and memory care facilities, or even in certain areas in hospitals where you may have psychiatric patients. Ensuring that individuals don't wander off or wander out of the facility where they shouldn't be going. Obviously, there's a risk of injury to the patient, if they do wander off, right? And unfortunately, there have been some tragic use cases or incidents of that. But also, I think just from a safety for the other patients, right? Especially in psychiatric wards, it's important that that those areas are restricted. So, being able to alert on these types of events, right? It may not always be that someone has actually walked out of a door. It may be that they're standing in front of a door and waiting, right? And so that may be a risk as well. So these types of things can all be, detected and alerted on. Similarly with fall incidents. So, I mean, this is not just in long-term care assisted living, but also in hospitals where, it's important to quickly identify someone if they do fall down. So, being able to have that information, have that data, so a nurse or the staff can respond to those types of situations as quickly as possible. It's always, you hear about some of these horror stories, especially in long-term care facilities, where a resident has fallen down, maybe in a common area or in a hallway, and no one gets to them for a couple hours. And so those are the types of situations that we're trying to avoid, right? Again, making this data and the insights from these cameras more actionable in real time. And then, lastly, just from a safety perspective in environments, smoke and fire is always important, right? Obviously, all of the facilities have smoke detectors and all of the standard precautions, but there's also other ways to detect smoke and fire that could, be a little bit more proactive from a visual perspective. So a lot of times with smoke detectors, it takes a while for the detector to sense the smoke, just because of the positioning, or because how much time has to elapse before the smoke gets up to the detector. So there's additional things that we can augment existing systems with, as far as being able to also use the cameras that exist in these facilities to do the same type of detection, but more from an optical perspective. So as opposed to a chemical-based sensor, also being able to look for optical signs of danger, right, from smoke and fire that may exist. And then from a operational efficiency perspective, so I think this is probably also top of mind when we think about the variety of staffing shortages that exist in different healthcare facilities, whether it's skilled nursing or physical therapists, or whatever the case may be. As we know, there's a lot of time spent in hospitals, especially around things that don't involve actually caring for the patient. And so a lot of the things that we're trying to do here really revolve around reducing some of those more administrative tasks and trying to get the staff back to the more important things, right? Which at the end of the day is taking care of the patients. So simple things in terms of just automated check-in for contractors, right? So there's not necessarily long lines for people to log in and check in and out of their shifts, and automating a lot of this content into HR systems, whether it's for compliance or for payroll tracking. Again, a lot of that using identity detection can all be tracked, can be done in real time, so you can eliminate a lot of the paper-based processes associated with this. And also, there tend to be a lot of auditing and reporting and logging requirements in healthcare facilities. So, we have the ability to automate a lot of that, right? Whether it's visitation reports, whether it's attendance logs, any of those things. Again, with all of this data that we talked about, all of those aspects can be automated as well. And this is, probably the area I think where we're spending the most amount of time right now, is really analytics around improving patient care and operational flows. So when we talk about things like activity tracking, this starts to become important in use cases, for example, like for sitters or night nurses, where you have critically ill patients or other patients that require 24/7 monitoring. And a lot of these use cases are handled by physically having a person sit in a room and watch over the patient, usually 24/7. And so now what we can do with a variety of analytics coming from a camera is look at different things that the nurse or the sitter will be looking at. So is the patient sleeping? Did they roll over? Did they turn over in their bed? Are they trying to get up out of bed, right, which may require someone's assistance? If they went to the bathroom, for example, how long were they in there, right? And if they went in and didn't come out, well, that's probably an issue where someone needs to be alerted after a certain amount of time. So these are all things that we now have the ability to track, right? And what this allows us to do is potentially free up staff from having to physically, sit in a patient room 24/7, but you can still provide the same level of care and same level of monitoring, but now we do it in an automated manner. So when there is an event that someone needs to go handle, they can see that in real time and they can go, have that interaction with the patient, as opposed to, sitting in the room 7, but 90% of the time not having to do anything. So again, just trying to allow ways for the staff to be more efficient and really be able to provide care where they're most needed. And sort of shifting gears a little bit, talking about the outside of the facility, right? So parking and just automation around how all of that is handled always tends to become a challenge. So ensuring that, for example, only physicians are parking in the physician lot, or that you don't have physicians parking in the visitor or the patient lots. Are there cars that have been there for too long? Are there, is the parking full, right? So do you need to redirect people to other spots? Again, all of those things can be automated as well. So if you kind of think about, all of these capabilities, just run through a simple scenario, kind of in an end-to-end workflow, right? So as you put all of these things together, what could that look like in a typical healthcare facility, right? So you talk about, sort of the safety of residents, for example, right? So elopement and alerting if someone wanders out of the facility, access into restricted areas. So in this case, maybe a medication room, right? Being able to control that and who's able to go in, go out, make sure all of that is logged as well and audited. So if there is an issue with, medication, then there's a full audit history of who went in, who went out, and what happened. Unauthorized access, right? So again, tracking who gets into these restricted areas and whether or not they should be there. From a safety perspective, tracking weapons, maybe people tailgating into an entrance, all of those things probably require some real-time notification. So being able to address those security threats in real time. And then, helping visitors and patients find their way in a hospital, as well as automate some of the things that they need to do as far as checking in, having a record of them, having it all logged in a secure manner, and having all of that data stored and be reportable and auditable. So that's kind of the sort of the high-level view of how we see the portfolio and some of the capabilities that we can bring to bear in the healthcare setting. Love to kind of talk through this in more detail, but maybe we'll do a pause and give all of you an opportunity to ask questions and hopefully have a discussion around some of the challenges that all of you see in your facilities, and hopefully how they relate to some of the things that we discussed.
Thus far we've gotten a couple of questions. One is kind of an administrative question. Will the slides be made available? And obviously, with your permission, Chris can send those out after the webinar, even if it's tomorrow, if that's okay. There is one question pending.
Absolutely. So the slides, yes, the slides will definitely be made available, and I will send them out to Chris so they can be distributed to all of the attendees.
Perfect. Thank you. Here's a question that's pending. When the, I guess, observation of people detects, as you indicated, a weapon that is visible, do you have to physically be looking at a monitor to see that, or does your intelligence incorporated into this sound some kind of alert that they've detected this?
Yeah, so great question. So the short answer is it's all, it could be all of the above. So let me kind of explain the process in a little bit more detail. So Obviously you have a video feed from a camera, and that camera is being, or the video feed is being analyzed in real time. So when the artificial intelligence algorithm detects that there's a weapon there and there's a security threat, at that point, once that event is triggered, there's a variety of workflows and actions that can happen after that, which is all can be really driven by whatever the process is in that specific facility. So just to walk through a few examples, it could be a real-time alert that goes to a security guard or to an officer with an image of the threat and the location as to where it is and what's going on. Right, so that's one potential action. There could be an automated alarm or an audible notification that goes off. There could be some sort of lockdown procedure that's triggered as a result if the threat is deemed sufficient and there's a risk. It could be, any combination of those, right? So it could be, some of those things in isolation. It could be all of those things together. It really depends on the workflow and the protocols at that facility, but there's flexibility from a platform perspective to really drive, I would say, virtually any action, as long as it has some way to be integrated in and automated. But those are kind of the most common ones, right? As far as notifications, audible alerts, and locking doors and those types of things are typically what you see.
One other thing that was asked, and it's more of a logistical question. Let's assume you're in labor and delivery, and you've got the facial recognition of parents and grandparents to gain access. What if a visitor accompanies the family that they had not had before? How easy is it to get through so they can come in to observe, for example, the newborn?
Sure. So let me, I'll answer that from a couple different perspectives, right? So first of all, the level of security that's applied is really up to the facility to determine what's appropriate, right? And so what I mean by that, there's a couple different scenarios. In the most restrictive sense, you could say that only mothers, fathers, grandparents of the newborn are allowed in, and everybody else is not, and that will trigger an alert, right? So in the scenario you described, where let's say a father comes in with a friend who's has not been there before, right? So they're a visitor, but they've not been logged. In the most restrictive sense, that would trigger an alert, because even though the father is known, the friend that's with them is not an authorized visitor. Maybe they didn't check in properly or whatever the case is, but if they're not known as an authorized visitor, that could still trigger an alert if that's the behavior that's intended. The flip side of that could be, you could say that if one of the individuals is authorized, so in this case the father, then if somebody unauthorized is with them, then we can say, well, that's okay because they're with an authorized individual and we don't see that as a threat. So either scenario is workable. It's really just a question of how the system is configured, but either use case would be acceptable from a platform perspective. And then the other part of the question, in terms of the ease and the level of effort to add a person. So let's say the father comes in with a friend who's visiting, and they're going to come back the next day. The process of adding that friend's face to the database so that they would have access is, literally a 30-second exercise, right? It's a simple, act of taking their image, associating that with a name, adding it to the system, and they would then be authorized from that point forward. And there's refinements or granularity that can be added to that level of access, right? So maybe you say, for the father, they have access into the maternity ward 24/7, right? So they can go in and out as they please. But for the visitor, even though they're authorized and allowed to come in, they're only allowed to come in during visiting hours. So maybe the door only, if they're by themselves, the door only unlocks for them between 8 and 5. But if they came in at, say, 7 p.m. at night, even though they're on the approved visitor list, they would not have access into the facility. So there's different, I think, levels of granularity that can be set, and it really comes down to the use case and, you know, what the policy dictates in terms of visitation and, you know, who's allowed in, who's not allowed in, and what the hours are, right? And even things like, you know, I know especially during COVID, this was important in that a lot of times only a single visitor was allowed, right? So the parents had to choose who that one visitor was going to be. And even then they were restricted to only visit during certain hours because they're trying to restrict the number of, you know, new people coming into the facility at any point in time. So those are all
Great.
things that those policies can all be configured, really just depending on the use case and, you know, the policies that exist.
Right. We're getting quite a few questions coming in, so we'll kind of do a lightning round with you. Wireless video systems tend to be easily compromised. That's the first part of the question. What safeguards does Konica Minolta have in place to address these types of issues?
Yeah, so that's a good point. I guess that my short answer is simple in that, you know, none of the systems we deploy are wireless, especially around camera systems, precisely for that reason. They're all, you know, wired systems. Obviously, there's the ability to, you know, backhaul some of the data through wireless networks, and so that can all be done. But from a security perspective, obviously, you know, anything that's physically wired is going to be more secure, right? So I think that's a given. From the camera perspective, security is a huge concern for us, right? Obviously, you know, you always see news reports of cameras being hacked and then, you know, video streams being made available on the internet, and obviously we don't want that situation. So the cameras themselves are engineered with a very high level of cybersecurity protection. And without getting into all the details, there's a fair bit of hardening that's been done, both from a hardware perspective within the camera as well as a software perspective, to really prevent anyone from being able to get in and capture that video stream. You know, certainly there's a lot of software hardening, but even from a physical perspective, right, not being able to you know, just remove part of a camera off the wall and tap into it, right? So all those types of things have been kind of thought through in terms of the physical design as well, really to provide a hardened platform at the end of the day.
Thanks. Another question is, you know, some hospitals have certainly invested in some security cameras, etc. Do you have hardware and software that you can fully integrate not only within the system, but with potentially any existing hardware or software at the facility?
Sure. So in most cases, yes. All right. So again, from our portfolio perspective, it includes both hardware, you know, cameras as well as software, which is really the analytics that we've been talking about. The majority of these analytics and the AI is agnostic, is camera agnostic. So when you talk about existing camera systems that, you know, that may already be in place, for the most part, you know, those, assuming they're relatively modern, are all perfectly fine to drive a lot of these analytics and data. Obviously, you know, the question of positioning of these cameras, you know, comes into play, right? So depending on what you're trying to achieve in a certain area, you know, the cameras may or may not be positioned correctly to get, you know, get those alerts or to observe that behavior, right? In some cases, it may be a question of distance. For example, if you're trying to do weapon detection, generally a surveillance camera is fine to be able to do that and run those analytics. But if you have a camera, let's say, looking outdoors, mounted on a, the top of a 4-story building, trying to detect someone carrying a gun coming in, that may be challenging, right? Just because the camera is too far away from the object. So there's things like that that always need to be looked at. But in general, the majority of these analytics can run on existing cameras and camera systems, and have the ability to integrate, not just from an analytic perspective, but also what happens with the analytics, right? So the data can all get pushed to other systems, to other operational systems or security systems that may already exist. There's a fair bit of flexibility in terms of how that happens. We don't necessarily expect this to be a rip and replace type of platform or solution. Obviously, there have been investments made in terms of security platforms and camera systems. And so for the most part, we try to coexist with that, and really add this as a layer of intelligence on top of some of the physical infrastructure that may already exist.
Thanks. Another question, approximately how many healthcare institutions, and I don't think that's just acute care, you could look at skilled nursing, you could look at assisted living. How many healthcare type institutions across the country are currently using this Konica Minolta technology?
So I'm not sure if I have a accurate number off the top of my head. I mean, I know we have facilities using this technology pretty much in every part of the country, probably in the dozens. But I don't know, Ty, if you have a better number off the top of your head, but it's definitely been deployed in a number of different types of healthcare institutions. So both, long-term care, assisted living types of facilities, as well as, large hospitals and clinics. So it's kind of been the spectrum. But I don't have specific numbers off the top of my head. It's certainly something I can follow up on, but it's a sizable number.
Agree. And we can definitely get that data for you, or any type of use case. So that's not a problem.
Another question that's come in, and you touched on this as you talked about scalability, but it's a pretty good question. It said it's obvious as you look at especially healthcare systems and large healthcare systems, they could spend millions of dollars on security. Has Konica Minolta developed any kind of risk matrix to help healthcare systems use it to deploy dollars to get the maximum benefit? In the example they gave, let's assume you spent $200,000 in security at a large clinic, but you had that multiplied times the number of clinics. Are you spending your money effectively, or is there a better way that you could have a data-driven answer to help you make intelligent decisions to have security, but do it cost effectively?
Yeah, so I think that's actually a great question. So the way we typically engage with customers around that, right, especially when you're looking across a system or a network in a variety of facilities, is typically, we'd sort of engage with our clients first in those scenarios to do a little bit more of a little bit more of a whiteboard session around what are the needs, right? So kind of start with a little bit more of an assessment to figure out what those needs are, because it may not be uniform across every facility. So kind of working through the where we see the top priorities, where, and working with our clients around those priorities, and then really honing that into a plan for what may be required at each individual facility. So, most of the time what you're not going to see is that it's necessarily cookie cutter, right? Even though there may be, say, 20 or 30 facilities in a network, the needs may vary quite a bit. And so what we try to do is, at least starting with the assessment, understand, can we categorize the sites maybe in different profiles, right? And then kind of come up with a model that addresses the spectrum and needs within each profile. So we're not necessarily, like you said, deploying $200,000 of security equipment and software at every facility, but it's really going to be driven by what problems we're trying to solve at each facility, right? And they may be very different in a kind of small outpatient clinic versus a large acute care facility. So we try to sort of look at, again, starting with the problems that we're trying to solve in each of those spaces, come up with via an assessment, sort of understand what the profiles are, and then really try to target the capabilities that are deployed a little bit more so that we're aligned to different profiles in those different use cases.
And
Thank
also
you.
not to cut you off there a little bit. And there's also different buying groups and group purchasing structures that we could use to kind of help leverage the benefit or leverage the pricing. So there's different types of things that we can use to help.
Thank you, Ty. Here's kind of the final question, but it's a good question. I think this is now moving outside of the facility. It says, do your current solution track analytics and data? Does it track things like license plates, facial recognition, vehicle color, etc.?
Yeah, absolutely. So when you look at what goes on, and we kind of look at the facility as sort of a whole, right? There's an interior and there's an exterior, but there's data that's captured in all of those spaces. So absolutely, when we talk about license plate recognition and make model capture, obviously all of that occurs outside of the building. So yes, all of that data can be captured. That can all be tied into different types of automation. Same thing with facial recognition, right? That can be on the interior of the building. It could also be on the exterior of the building, just depending on the use case and how it needs to be baked into the workflow. So absolutely, both interior and exterior use cases.
Yeah, here's one other quick question that somebody sent in, and it's a good one. Let's assume you have a disgruntled member of a patient's family who actually got physical with an employee, and unfortunately we do have that in hospitals, or you have a terminated disgruntled employee, and you don't want either of those types back in the hospital. When you do the facial recognition, can that also trigger an alert to the security that one of these, I don't want to use the word perpetrator, but one of these people not wanting in the facility have entered? How does that work?
Yeah, I mean, it's essentially as you described it. And from a facial recognition perspective, you could set it up to do whitelist or blacklist or both, right? And by whitelist, I mean, a list of people who are authorized to get in. And that may be what you use for access, let's say, to a maternity ward, right? But what you may have at the front of the building or at the main entrance is maybe some sort of blacklist. So individuals who, maybe fall into that category of disgruntled employees, or individuals who have a history of exhibiting violent behavior, those individuals could be added to a blacklist. And then what happens when that individual is detected at the front door? Again, there's different actions that can be taken, right? You could ensure that the door gets locked, maybe in real time, or maybe it's a notification, an alert that goes to the security staff that this individual is here at this entrance at this time. May require some intervention. So the workflow after the detection can be customized, but essentially, yes, it would, there would be a known sort of list, a blacklist of individuals, and then once that individual is identified at the door, different types of actions can be triggered off of that.
Thank you. We don't have any questions pinned in. Sooketoo, I just want to thank you. An excellent presentation. We really do appreciate you making the slides available, and we want to thank everyone for participating. But Ty, we'll turn it back over to you if you have any final thoughts or comments, since you're our representative here locally with Konica Minolta.
Thank you, Steve. To close, as Sooketoo and everyone mentioned today on the call, there's a different variety or a lot of variety the way this technology can be used. And the fact that you really do not have to get rid of the technology that you're using, that you can't use it and integrate this into what you currently have is huge. I know that there were some questions regarding pricing or doing an assessment. We certainly would like to come out and do that. And so my information will be provided after this call. And if you would like to do that, I certainly will contact you and have a team come out and would like to get started and have additional discussions. So I thank you very much for your time today and look forward to speaking to everyone.
Thank you, Ty. And thanks so much to Konica Minolta, and thanks to the people that participated as attendees. With this, we're going to conclude the webinar. We thank you all for participating. Have a good day and stay safe.
Thank you.